So there may be a, obviously it can cause, and there may be a violence like a gunshot injury or sometimes stab injury as well. Fetal head to pass through the birth canal at the time of the delivery and permits the brain enlargement after the birth. But as the skull basically enlarges, this fontanelle gradually diminished to form the fibrous connective tissue. And there is a Sharpie's fiber, like the tissue layer that is called the Sharpie's layer. Okay. Then comes your gomphosis. These are the immobile joint found only between the teeth and the socket of the mandible and the maxilla. So these are the periodontal ligament is a fibrous tissue connecting to the tooth and the socket. Like you can see in this image, right? So this is the enamel and this one is the dentine. So this is a periodontium anatomy, right? So this is how your composite joint basically looks like. Okay, let's move ahead. Now your syndesmosis joint. So regarding the syndesmosis, these are amphiarthrosis, like slightly movable. So this fibrous joint maintain union between the two long bones, thus restricting the divisive forces. So all these syndesmosis are basically, as they are the multi-axial, so obviously you can understand they are not very much stable. To make this joint stable, what we do need to go for? We need to surround them with multiple ligaments. Okay.
Okay,
Now
sir.
you okay. Now the typical example is your acromioclavicular joint. There is a intertarsal and the intercarpal. These are the one. Okay.
And osteocytes.
Look, your osteoblast is basically some progenitor cells. Okay. So they
Okay.
basically synthesize and secrete the bone matrix in that case. And your osteoblast has two fate. Okay. One, they can go into production of the osteocyte, or they can remain quotient like osteoblast cell lining in that case. So from the osteoblast itself, they basically form the osteocyte. Okay.
Okay. Osteocyte is a mature form of the osteoblast.
Yes, you can say that. And it is the like most of the cells are basically the osteocytes. Okay.
Okay, sir. Okay. Thank you.
Now there is the osteoclast, which is the bone reabsorption. So as a result of that, there is supposed to be the balance because your osteoclasts are supposedly producing the minerals and all the apatite crystals are already forming. Now someone is supposed to be there who are going to like absorb or reabsorb that dead tissues or the defective areas or the defective uh, form bones, right? So they are the one with a multinucleated mononuclear macrophage cells typically. So your receptor activator of the NFK beta and the Rankel pathway, they basically works in that way. And macrophage CSF are two cytokines. They are the critical for the osteoclast function in that case. Okay. Now your PTH, like the parathyroid hormone, basically plays the key factor in here. Your PTH stimulates the osteoclast activity while calcitonin eventually inhibits it. So your PTH associated with the bone reabsorption while the calcitonin inhibits it. Okay. So till now, if there is any queries, please do let me know. I'm happy to answer your queries. If there is nothing, we can wrap up our today's session.